there. You had a very harsh response on Twitter to what the president told the Mexican leader. You called his words disgusting. Or what's your message to the president?
Well, his words were disgusting. They're an outrage. And my message really is this. He should stop insulting people and instead work with us to get the resources to our state and states all around the country who are also challenged by this epidemic so that we can roll up our sleeves, get people more medication-assisted treatment, and work together to beat this thing. And, you know, what we've seen from the administration so far is efforts that would actually undermine what we've done so far. The administration's attempt to repeal the Affordable Care Act, which had Medicaid expansion. In New Hampshire, we have bipartisan Medicaid expansion, and people on the front lines of this epidemic say that's the #1 tool they have to combat the epidemic. And then you see the president's budget, which would defund critical resources for our ongoing work here. So my message to the president is simple. Stop insulting people, learn about this illness, and help us combat it and beat this epidemic.
Because he has established a task force to deal with opioid-related deaths. The New Jersey Governor, Chris Christie, is directly involved. Other top officials are directly involved. Have they consulted you? Has the president asked you for your thoughts, or anyone senior in the administration?
Well, they certainly consulted with a group of us who are senators from states where this epidemic is particularly challenging. But my message here is, let's stop the talk and let's get to action. People are dying every day from drug overdoses and from this epidemic. We need to come together and do what the experts in the field already have identified as critical actions. The interim report by the President's Commission made recommendations that are action items that I've been supporting for a long time. The National Governors Association rolled out similar recommendations now a couple of years ago. This isn't about talk. This is about action. And I would invite the president to learn more about this, but more importantly, to commit to providing the resources to New Hampshire and other states who are challenged by this epidemic so that we can beat this thing and save lives.
Is there any serious prospect of bipartisan cooperation in the Senate now that repeal and replace of the Affordable Care Act, Obamacare, has failed? Any prospect of bipartisan cooperation to try to improve, to fix some of the serious problems of Obamacare?
Oh, sure. I mean, you heard Senator Alexander and Senator Murray, chair and ranking member of the Health Committee on which I serve, announce that we were going to have hearings in September about how to make the improvements that Democrats have been calling for some time and hoping to work with Republicans on. And, you know, Democrats and Republicans have been working on the opioid crisis together as well. Senator Young and I have both successfully put into the FDA reauthorization some critical work to make sure that doctors know about the dangers of something called abuse-deterrent opioids. So we have been doing some work together, and there is bipartisan interest in particular on the opioid crisis. It affects people from all walks of life all across our country, and we really need to be coming together and helping people get healthy again.
Senator Maggie Hassan of New Hampshire, thanks so much for joining us.
Thank you.